Africa's seen pandemics before, so what's the strategy for taking on COVID-19? Hello, everyone. I'm François Picard. Welcome to another confined edition of the France 24 debate. With lockdowns all over the continent in some parts and other parts open for business, we're going to be asking how to meet the challenges of containing the spread of coronavirus, particularly in working class urban areas where confinement as we know it here in France, well, it's just not realistic. There's the immediate health emergency, and then there's the economic pain that's sure to follow. Donor nations at the G20 and IMF agreeing to debt freezes and plans for emergency funds. But how will that help ordinary citizens? And what's the plan if the pandemic runs and runs? Could this also be an opportunity for a fast-changing continent, the world order as we know it crumbling? How does it see itself going forward, Africa? Tales abound of civic groups and local communities showing incredible resourcefulness. But what about at the national level and at the continental level? Once again, we're facing a real test of leadership. Today in the France 24 debate, we're looking at how Africa is handling COVID-19. With us to talk about it from Bobo Dioulasso in Burkina Faso, Dr. Stanley Okolo, Director General of the West Africa Health Organization, the regional equivalent of the WHO. Thank you for being with us.
Thank you very much, Francois.
We also want to welcome from London, Dewa Mavinga. He's the Southern Africa Director for Human Rights Watch. You've penned a piece about how access to clean water is particularly important in these times. We'll talk about that shortly. Thank you for being with us.
Thank you so much, François, for having me on the show. Thank you.
And across the French capital, we turn to the Africa Report's editor-in-chief, Patrick Smith. How are you in your apartment?
Yeah, very confined, but bearing up. And like all journalists at the moment, terribly busy for some reason. It's like a big news story somewhere.
There are big news stories. Throughout the continent, there's the question of what the confinement means, particularly in those urban areas, as we were saying at the outset. One example, Nairobi, the capital of Kenya. It's home to Africa's largest slum. James Fazina has the story.
Residents crowd the streets as shops remain open for business. It's the best compromise that the Kenyan government could find, but enforcing social distancing remains a challenge.
If you impose a lockdown, for example, in the country as at now, and in an informal settlement, and people don't change their behavior, they don't comprehend the essence and the significance of trying to take the precautionary measures. Even if you impose a lockdown and they don't observe the necessary precautions, there is nothing you've done. So to me, the most important thing is people changing their behavior.
Kenya has so far imposed a nighttime curfew, but President Kenyatta has hinted at a full lockdown to force people to comply. But in a city such as Nairobi, where over half of residents live in overcrowded slums, there are bigger fears than the coronavirus. Scenes of chaos erupted as crowds scrambled for food aid last week, since the measures many relying on informal work are struggling to feed their families.
Na wakiweka lockdown aje tutakuwa tunakula aje? Sasa hiyo tutaamua heri tukufe corona tutoke nje tusikufe njaa ndani ya nyumba.
They can't risk the people of the slum, in this slum particularly, going hungry and then violence ensuing in the surrounding neighborhoods.
Mass testing could allow for softer measures, but most countries on the continent remain ill-equipped to carry out large-scale tests.
Yeah, disruption of supply chains means that for places that depend a lot on the informal economy, it's sometimes we've seen chaotic scenes, and we've seen those also in places like Lagos. Dr. Stanley Okolo, what's your response when you hear in that report that shopkeeper saying it's better to die of coronavirus than to die of hunger?
It is a similar refrain, isn't it, across Africa? There are a lot of concern amongst the people, particularly the less well-to-do people, regarding what is the impact of coronavirus, which they haven't seen on them vis-a-vis the impact of poverty, lack of hope, and the fact that they cannot easily foresee where their next meal will come from. That's, of course, why a lot of our heads of states in the countries have stepped up to the plate to try and look at measures that will help the poor people. Also, like a place in Lagos, which you mentioned, and in Nigeria, Nigeria has a differential lockdown. So some of the lockdown is total in Abuja and Lagos, and another state called Ogun State, where you have the hotspots, but it's not a complete lockdown in other parts of Nigeria. And the Nigerian government has a relief package, which is destined for the underprivileged and the less well-to-do, because we know that a lot of people are living hand to mouth ordinarily, less well so now that we have coronavirus.
So at the level of the West Africa Health Organization, what advice are you giving national governments? When's the right time to impose a lockdown?
It's a very difficult and complex situation. As you know, we started off with trying to contain the importation of coronavirus into our countries. And so most of the things that we did then was to ensure that we maximize surveillance at entry points, including not just the airports, but also seaports and borders. We have now moved on. We are in a situation where we are having community transmission or local transmission in a good percentage of our countries. 8 of our countries now we regard as high burden because they do have upwards of hundreds of cases of confirmed coronavirus. And therefore, it is important in order to contain that what is important is that where you have hotspots, you go into total lockdown. And we have a map that shows us some of the areas that are hot points. But the other critical thing to it is not just the lockdown, it is the contact tracing. And it is the fact of what you do during lockdown. Because if you don't contact trace, you may lock down an area, but somebody has escaped from that area. Well, not escaped, but somebody who is a contact is no longer in the area you've locked down at the point. So the advice to our governments and to our authorities remains the same public health advice that we have been pushing. We try to contain this virus and we'll contain it by measures to reduce person-to-person transmission.
And at the West Africa Health Organization, you're, of course, beholden to the national health services throughout the member states in West Africa. What's the situation right now when it comes to how bad the pandemic is in West Africa, and also how much of that contact tracing that you talk about can be done?
Just, Francois, to correct a small impression that you made the first time, WAHO, which is the West Africa Health Organization, is not the West Africa arm of WHO. Nothing can replace WHO, and I think we have to say that clearly and loudly. The WHO is there for quality, for helping us have communication, for helping us set standards. West Africa Health Organization, however, is the health institution of the Regional Economic Commission, ECOWAS. And so we are the health arm of an intergovernmental organization that brings together the government. So we work, as you say, by the consent of the nation states. And yes, the nation states, there are varied, as you listeners might know, we have 15 countries, 5 Anglophone, 8 Francophone, and 2 Lusophone countries. And our countries stretch from Liberia, Gambia, Sierra Leone, to large countries like Cote d'Ivoire, Ghana, Nigeria, and Senegal. And therefore, the skills, the infrastructure, the capacity are also varied. But the structure in terms of public health response is similar. It is the same. It's what we have built across the countries. It's only that when you then go on to how many personnel have you got, for example, in Niger, in order to contact trace maybe 1,000 contacts, you then find challenges. And that is one of the things that the regional organization that I work for, as the Director General, we are supporting those countries. Now, similarly, some countries have difficulties in terms of how they require to double check regarding modeling of what they're having, and also difficulties regarding infrastructure. We are bulk purchasing critical medical supplies and distributing to these countries. And we're also grateful to our partners, tremendous partners that we have, both from the Europe and the West, and also from international bodies who have stepped up to the plate and given us emergency funding to support these countries. So yes, it's varied. And the main issues are issues of personnel, issues of material, and issues of infrastructure. If you have to quarantine...
What can you tell us today, Thursday, as far as what numbers we have in terms of how widespread COVID-19 is in West Africa?
We have about 3,900, 3,800 cases today. But do remember that all our cases is a day behind because we report as at the end of yesterday. So we have about 3,799 cases. We have, of course, a lot that have recovered. So ongoing is just under 3,000. We have high burden countries that are the countries that we have seen increases. As at yesterday, we had about 180 new cases. The day before was quite high. We had about 200 and something new cases across the 15 countries. So countries like Cote d'Ivoire, Ghana, Niger, Senegal, Burkina Faso, Nigeria, Guinea are countries that are high burden, and in fact included in that now increasingly is Mali. But these are due to some different things. So for example, in Niger, and Ghana, they started massive testing. And as you increase your testing of suspect cases and contacts, you find that you increase your numbers.
Patrick Smith, your reaction to that countries like Niger and Ghana are able to begin mass testing?
Well, from what I understand, in Nigeria, the Nigerian Center for Disease Control, which did an incredibly good job on contact tracing and testing for Ebola when somebody turned up at Lagos Airport and spread the disease around. They're using many of the same personnel. They've ramped up the capacity of the Nigeria Center for Disease Control in Abuja. It used to be a very small building. It's now a big story building. They have a lot of people and new equipment come in. In fact, the head of the Nigeria Center for Disease Control went off, Chikwe Ihekuwiazu, went off as part of the WHO mission to Wuhan in early February to look at conditions on the ground and came back, having spoken to the Chinese officials about their strategy and their tactics for dealing with this pandemic, and then brought that knowledge back to Nigeria and has been communing with all the health professionals across the region and indeed across the continent. And as we've seen, there's a big capacity in Ethiopia, where the Center for Disease Control has a big mission there, and in South Africa. So my take, I mean, I'm not trying to be stupidly optimistic about this, I hope, but what I would say is that the experience of Ebola and measles and multiple disease epidemics in Africa has given African communities and African structures in government some confidence to deal with this in a way that that European governments clearly, and many Asian governments clearly lacked, because they never thought it was going to happen, or if they did, it was one of those sort of black swan threats that were, they weren't really prepared for. So I think the infrastructure that has been used to deal with epidemics before in Africa has suddenly triggered. Plus, I'll finish up here, but on what's happening in Lagos, for example, I think that's really very important, because Lagos, it would be a nightmare of a city if the disease really took off among its 20 million people, the estimates are, And the government there, and particularly the state health commissioner, who is a specialist in epidemiology and infectious diseases, has been steadily working with this center in Yaba, which is a suburb of Lagos, to build up research capacity and also practice capacity to deal with these sorts of events. And they've got quite a sophisticated digital tracking system using the mobile phone networks, which, of course, are prevalent in Nigeria. I think there are probably more phones in Nigeria, more mobile phone subscriptions in Nigeria than there are people now. So all of that is helping matters. I'm not saying it's not a huge problem. Of course it is. But I'm saying that you'll see lots of examples of authorities right across the country, the continent and communities really making a very strong pitch to deal with this, because they know that they've got to avoid what happened in Europe, because the health services in these countries cannot sustain, cannot tackle the weight. Well, we've seen that European health services can't. So how much more the likes of Mali or Niger and Burkina Faso?
Dewa Mavinga, here in France, we're certainly behind the curve when it comes to testing. They're trying to ramp it up, but we're definitely behind when it's compared to other countries. Tell us about what it's like, first of all, in your native Zimbabwe and in South Africa, where you're usually based.
Well, in Zimbabwe, there was a slow government response to COVID-19 in terms of locking down. But on the 30th of March, Zimbabwe announced a 21-day lockdown, which is in effect and might be extended by another 2 weeks. But the challenge was that this lockdown was not accompanied by important things like testing. So far, Zimbabwe has only had 716 tests and has 23 confirmed cases. And the challenge is that this then gives us a false picture. There is no tracing. The authorities are only responding to cases where people come forward because they are very sick. And also, given that prior to the outbreak, Zimbabwe was already struggling from a collapsed health infrastructure. In fact, last week it had to take doctors to go to the court to force the government to provide protective personal equipment to all health workers in the public hospitals, about 2,000 doctors, because this had not been provided, and the government had not taken the initiative to reach out and to ask for testing equipment as well as protective equipment for doctors and nurses. Within that context of the lockdown, some of the challenges include that half the population of Zimbabwe, about 8 million people, do not have access to food, and therefore their food security situation becomes even more severe under lockdown conditions. And also, if you look at the capital city, Harare, over 2 million people do not have access to sufficient clean water. And to effectively respond to COVID-19, there is need for people to maintain high levels of personal hygiene, frequent washing of hands, using clean water, and the water is not available. And this has led to a disregard of the lockdown requirements, as well as overcrowding in public spaces like boreholes, where people go to fetch water, sometimes spending 9-10 hours in a queue or even all night. And in those circumstances, it's very difficult to observe social distancing. And as Human Rights Watch, we have said to the authorities, it is important, it is critical that the lockdown measures be accompanied by a provision of essentials like water and food. And we saw that in South Africa, there has been a better way in terms of the lockdown and widespread testing. So South Africa now.
I was going to say, Dewa, because I know in South Africa and some of the townships, the lockdown's been quite radical. Nonetheless, that issue that you mentioned, that crucial issue of providing water to the citizens, how's it going on that score?
Well, South Africa has done better. The government has told municipalities not to cut off water and to provide water to informal settlements, to townships. And in some cases, this is the first time that townships have received water. So mobile units have been deployed. So South Africa has done much better in that regard. But of course, the implementation of the lockdowns has been problematic in both South Africa and Zimbabwe in terms of how the security forces, the soldiers and the police, have been heavy-handed in terms of beating up people to keep them indoors without adequately explaining the...
We seem to have lost the connection there slightly. All right, we seem to have lost the connection there. We're going to reconnect as soon as possible with Dewa Mavinga. Patrick Smith, your reaction?
On the water and sanitation issue, I think that is the much harder side of the bargain. I mean, governments across the continent, I think there are now 44 governments across the continent which have one form of restriction or another on people. And what a lot of the community activists are saying, okay, we are going to help you impose these restrictions on us, but the trade-off must be you've got to get serious about two things, which are health and sanitation. Got to invest in public health, because many of these countries have not been investing even up to the African Union level, which was like 10% of the budget was meant to be going on public health. A country like Nigeria with 200 million people was hovering around 5%. But that's quite typical. So there was underinvestment in health and underinvestment in provision of clean water. And I think one of the things about this crisis is that it's going to reinforce those calls for those community services to be available across the continent if we're going to avoid this as a recurring nightmare.
Yeah, because Dewa Mavinga, correct me if I'm wrong, but there are areas right now, because of COVID-19 lockdowns, that don't have access to clean water. And then there are those areas who've never had clean water and suddenly have it available to them.
That's correct. In parts of South Africa, and this actually points to the opportunities that are coming up in this public health crisis. That for South Africa, some townships, informal settlements, are now receiving water, and that this should then be, in terms of planning, an established framework going forward beyond this rapid response to COVID-19. And we're saying that if you have a right framework of response, it should not be just for this public health crisis, but it should go beyond. And it's quite encouraging that South Africa has taken this up, but concerns remain around how the security forces particularly have been resorting to excessive force to implement the lockdown measures, and not so much on informing and educating the public and the communities to embrace these measures. And I think the other aspect that I wanted to raise relates to misinformation, particularly from religious groups, that we have seen that it has also sort of undermined the responses, because when church leaders speak against the measures, then there is a tendency to disregard and to have more people at risk.
Yeah, that's an important point as well. Dr. Stanley Okolo, I know France 24 aired a report how in Mali, authorities have yet to weigh in on whether or not to leave mosques open in some instances. This issue of where religious leaders stand, how important is it?
Oh, it is a very important issue. Just let me correct something you said earlier. We are not talking of mass testing. We are talking of massive increase in testing, because, sure, of course, as you know, mass testing is different. Anyway, so yes, the authorities, in terms of lockdown and restrictions, it is really important to have the consent of the people. But let me give you one of the best examples we have across the region, and that is Senegal. Senegal was one of the early people who had a high number of cases. And in fact, they in the region had about the first or the second incidence of community transmission. And this was within a religious area outside Dakar called Touba. But the Senegalese authorities immediately implemented a lot of measures that meant that they worked with the community, including the president, worked with that religious community. They stopped a festival that was going to happen about a few weeks ago. And not only that, they were able to contain it. They utilized all those structures that we had across the region. And I know that we were talking about what happened in terms of the lessons from Ebola. One of the things that happened with the lessons from Ebola is the setting up of national public health institutions across all our 15 countries. And WAHO has driven that. We have also driven the strengthening of the laboratories. When WHO declared this and a public health concern of public health emergency of international concern, we had only 2 laboratories in our region that could test. By the time we had the first case in Nigeria on the 27th of February, we had only 5 laboratories. Today, we have 30 laboratories. In fact, Nigeria alone has about 8 and ramping up to 11 laboratories that can test for COVID-19. So these are some of the measures. But in terms of the measures that the authorities are now taking, the heads of government, that includes some of these mitigation measures we are talking about. Let us not forget that Mali, a great proportion of the country, is not within the authority of the government. And that is a key issue that I thought we should touch on. In West Africa, particularly the Sahel, a lot of countries are spending 20 to 25% of their budget on security. And the 15% Abuja declaration regarding budget to health, we are going up there, but actually it's tailored off before COVID-19 and it's going to go down. And therefore, it is really, really important to emphasize that if we wish to help IDA, international development assistance, maybe we have to restructure it. We have to start thinking of debt relief, and debt relief that is targeted towards those vulnerable people in these countries. Because even if coronavirus ends in about 3 months or 4 or 5 months, the insecurity remains, and we still have to tackle that.
Yeah, let's talk about the debt relief. But before we do, Patrick Smith, there was the French president, Emmanuel Macron. He granted an interview to sister station Radio France International on Tuesday, in which he talked about this issue of security for the Sahel region, for Chad, for Nigeria and Cameroon. Again, fighting COVID-19 in when you also have an insurgency, it's not easy.
No, and that was particularly pertinent that he brought up that issue, because the previous week, President Idriss Déby of Chad had said that he was pulling Chadian troops out of the regional efforts to fight the insurgents. And I think part of that statement by President Déby was also a coded criticism of some of the neighboring countries, perhaps Nigeria will be one of them, that he thought wasn't doing enough to support this regional campaign. It seems that since Idriss Déby made that statement, he's pulled back from that. But I think his own dilemma about how much he gives to the regional efforts to fight the insurgents and how much he spends on domestic issues, and now you have this pressing public health issue. I think that's the same calculus that a lot of countries have got to make. And it comes as some of the jihadi groups, certainly Boko Haram leader Shekau has said, this is sent from on high to help us in our campaign. I.e., he's saying that because the coronavirus has thrown the world into disarray and formal governments are at sea trying to deal with a public health emergency, that essentially they're going to find it much easier to prosecute their war. And I think to some extent, over the last month, if you look at the uptick of insurgent attacks, certainly in the Sahel, but also in actually northern Mozambique, you'll see there's some beginnings of a correlation between this insecurity, more insurgent attacks, and the distraction, if you like, of the pandemic. And I think that's something that governments have to watch.
Yeah, in that interview, President Macron saying there were 4 French soldiers, this was on Tuesday, who had tested positive for COVID-19 in West Africa. Dewa Mavinga, your thoughts on what do you do? How do you fight insurgencies like the one in Mozambique that Patrick Smith was mentioning when you have this health pandemic crisis?
I think what's important is the planning and a regional response. So this will be up to the Southern African Development Community, but also working closely with the African Union. The challenge has been that the crisis and insurgency in northern Mozambique in the Cabo Delgado province has been viewed as a national issue for Mozambique alone. And so Mozambique has been left to its to try and contain and deal with this problem on its own. And this is not sustainable because the insecurity has implications for the entire region. And a successful response in terms of health, this public health crisis, needs to address the insecurity that is there, so that there is access, and also that once and for all there is a containment of the crisis. But so far, the Southern African Development Community, SADC, has not spoken out strongly, has not come forward to support. And it is likely that if Mozambique fails, then the entire Southern Africa region would be severely affected by the insecurity crisis that is in northern Mozambique.
All right, we heard Dr. Okolo a minute ago make that call so that funds can be diverted towards what's essential, public services and public health. We heard the French president, when in that interview he gave to RFI, discuss the issue of a debt freeze for Africa. It was agreed to by G20 finance ministers. Let's listen to Emmanuel Macron.
Mais le moratoire, ça veut dire quoi? Ça veut dire on ne rembourse plus les intérêts. Vous nous laissez de l'oxygène. C'est une première mondiale. C'est une étape indispensable et je pense que c'est une formidable avancée. Maintenant, elle doit précéder d'autres étapes qui sont des étapes de restructuration de la dette africaine.
A restructuring of African debt is what's next, he says. Patrick Smith, as we speak, we're on the closing days of the spring meetings of the IMF and World Bank in Washington. Of course, this year, they're mostly virtual meetings, of course. Your thoughts on what donor nations, what the international community should be doing?
I think what happened yesterday, following President Macron's intervention, was the G20 taking the smallest of small baby steps in suspending, and it just means suspending. It doesn't mean cancelling. These countries are going to still have to pay this debt in 2 years' time, but suspending this the debt, and it's 77 of the poorest countries. The actual amount in question was a maximum of $12 billion, which is way below what's needed. I mean, you're looking at countries so far. If you add up the Western response, that is the European Union countries, plus the United States of America and United Kingdom, they put together rescue packages of over $5 trillion. So to talk about $12 billion for a continent of 1.2 billion people is pretty small, let's say. And in fact, President Macron went a bit further because when he was talking about restructuring of African debt, he actually raised the issue of should some of this be cancelled. And of course, that is absolutely anathema to some members of the G20. There is, I think, unlike the global financial crisis in 2008, there is no serious leadership of the G20. It's chaired by the Crown Prince of Saudi Arabia, who has very clear concerns. He's running his government's private equity firm, which is running around the markets of the West trying to pick up bargains. There's absolutely no statement or commitment from the leadership of the G20 aside, as I said, this minimalist debt offer. They're going to have to do a lot more, as are the private creditors, the commercial creditors, because the 77 poorest countries in the world owe over $100 billion in bonds, on payments on bonds to the private creditors. So I think inevitably we're going to have some sort of forum to restructure and renegotiate these debts. And the sooner it happens, the better, because otherwise you've got the specter of countries just not being able to pay and going into default. And if they go into default, then they get locked out of the markets, and all sorts of legal clashes are triggered and the like. I think there should be, out of these the spring meetings of the IMF and World Bank, a serious effort to have a comprehensive review of African debt and a comprehensive coordinated forum to discuss it and negotiate the restructuring.
Yeah, Emmanuel Macron's proposal, drawing a bland response, you might call it, from Beijing, saying it's a measure that can be considered in the proper international forums. Do you agree with Patrick?
Yes, absolutely. It's important that there be these measures of debt cancellation, suspensions of debts, in order to free resources that should then be channeled towards addressing this public health crisis. But I think it's also important on the part of the African governments themselves to properly prioritize and plan and channel the resources so that they reach the intended beneficiaries, because we have had a problem of lack of transparency in terms of use of resources and challenges with lack of planning, which has meant that resources have not been used appropriately. And Patrick mentioned the issue of the African Union commitments under the Abuja Declaration to allocate resources, at least 15% to the health budgets. This is not happening. So it's very important for African governments to properly plan and also to reach out in terms of support for resources from others beyond this measure of debt cancellation. And when the resources are available, to use them wisely and to deploy them in a way that ensures an effective fight to combat COVID-19.
Dr. Stanley Okolo, this is the billion-dollar question, if you will. Is COVID-19 going to kill more on the continent, or the economic pain that will follow? Because if the world economy goes into recession, if commodity prices drop, and a lot of African nations depend on the price of raw materials, if the supply chains are disrupted, there's going to be the informal sector and the formal sector that are going to be hit. What are your views in terms of what's worse, what's now or what's to come?
And you called it a billion-dollar question, so I'll hope to get the billion if I can answer that. Actually, it is a complex situation. I think what is happening is that our countries are in a better place in terms of the leaders and the people being together. And I say that, with so many years of knowing what it was like maybe 20, 30 years ago in Africa and in West Africa. So there is an understanding of that. Let me just say to you that the opportunities that we have with COVID-19 are many, immense. Countries that are now beginning to have the first of social system in place. Some of these allowances and some of these payments that are going to the poor, the farmers, that is the beginning of a social system, something we did not have before. And also, for example, in our own West Africa, ECOWAS, we have decided that we will not procure any materials for fighting COVID-19 that we can produce in the region and in the continent. So that again means that some of our factories and industries are not idle. One factory in Ghana, for example, is now producing sanitizers. It used to produce alcoholic beverages. So there are some of these issues that we have to do now that will help us for the future. And if I may, just 30 seconds on the debt relief. Think about it this way. We are aiming for governments to increase domestic funding for health. By the way, they're also receiving international debt assistance. If we were to have debt relief but targeted, hypothecated to women, children, education, that means that they will therefore raise the money that would have been used to pay for the debt relief. They will raise domestic funding and guide it towards that. So it really is a win-win, and I think we should be aiming for that. Thank you.
Just one final question for you, Doctor, just to remind our viewers once again, in a lot of places where people are watching us, confinement, self-isolation, as we know it here in Europe, it's not possible. What are the measures people can take?
It is a very difficult issue, but to be honest with you, there is a lot of improvisation. And so, for example, what is happening increasingly is that people are beginning now to wear masks, irrespective of that not being a culture here, because we know it's a culture in Asia and all that, because they are in close contact with people. You may find 5 people living in a 1-bedroom apartment. So that's one aspect. The second aspect is that, of course, anybody who is a suspect case of coronavirus, a lot of countries are now isolating them in terms of testing them, and if they confirm them positive, isolating them in institutions. And we don't have the luxury of what you could do in Europe or in America, where you can say you live alone, isolate yourself. We don't have that luxury. That puts more pressure on our infrastructure. And then, of course, the final thing is the whole essence of reducing the opportunities for mass gathering. And that is really working well in a lot of our West African countries.
All right, there's a lot to do. I want to thank you, Stanley Okolo, Director General of the West Africa Health Organization. Also want to thank Diwa Mavinga, Southern Africa Director for Human Rights Watch, Patrick Smith, Editor-in-Chief of the Africa Report, for joining us here for this confined edition of the France 24 debate. If you missed part of the show, if you want to weigh in on the conversation, you can do so on Facebook, on our YouTube channel, and on France24.com.